After the doctor looks you up and down and scratches their head, what do they say next? They say, well, we better go get an x-ray. And so I'm going to talk about one type of x-ray which you can read, and this is called a chest x-ray. So this is normal. Right here you can see the rib cage, and you can see the different areas are more white or more black depending on the particular type of density that is in that area. So the physics behind an x-ray is the darker it is, the more air there is, the whiter it is, the more dense or the more bone you're going to see. So this is the anatomy. So this is what the doctor wants to see when they take that picture of your chest. So I'll point out a couple specific features here, but you can see the rib cage once again. There's a couple things here. You have pleural cavities, which are essentially two big sacs that wrap around your lungs. And these sacs have negative pressure, which enable your chest wall to expand every time you breathe in. And you also, so down in the middle of your chest you have the sternum, and this is the xiphoid process, which is interesting because it's very easy to break. So if you do CPR on someone, you do it too low, you're going to come right down there and you're going to end up breaking their chest x-ray. So that's why if you've ever taken a basic life support class, you'll know that they tell you to put your hands up a little higher on the chest to make sure to avoid that. So if you look under the chest, here you see what the radiologist is going to be thinking about when they get that image. This is the picture of the heart, and the arch of the aorta through which most of the blood goes is right at the top of the x-ray. So here's a question. This is a case that we can look at. So if you look at this x-ray, we want to know what's going on here. Is this an emergency? What does this patient have? So if we compare to the normal, I want you guys to think about what's different between this image on the left side and this image on the right side. And these are the possible answers which you're going to be looking at. So two big things to notice on that one that was on the left side. Number one is this white area just to the left of the spine right there. You'll notice that the trachea, the windpipe right there, is over to the left. Also, you notice right here there's a more dark area on the right side. So the right side of the patient has more air. So this in fact is a medical emergency. This means that that pleural cavity I was talking about earlier is now filled with air. That means air has found a way to get in, and it's causing a tension pneumothorax, which is just a fancy word doctors like to use to make themselves look intelligent. Tension pneumothorax means you have a lot of air coming in and pushing on the left lung in this case. So this is another example from another patient who also has a tension pneumothorax. This time it's the left lung which is collapsed, and you can see the air pushing over to the right lung, and once again pushing that trachea over to the right. So questions, what causes this tension pneumothorax? So there are two main causes of a tension pneumothorax. Number one, you could have some kind of rupture of an air pocket. So because you have these negative pressure areas just outside your lung, you can expect that those can break. And number two is you could get some kind of a stab wound or any of those things, which will also cause air to enter there and then push on the lungs. So how do you treat it? Oxygen. And number two is you want to keep watching it. That might mean you continue to take x-rays. Just do whatever you need to in order to protect, to make sure that you don't get more air filling that space, which is just collapsed. But there's a problem. Sometimes more than 15% of the lung will be affected. This means that you have a very large, dark, air-filled space here, and the patient is in great danger of being completely oxygen deprived. They'll be unable to persist. And that's when you need to insert a chest tube. So you go in this area between the muscles in the back, right here, and you insert a chest tube right about there. And that can drain blood, or it can drain air, or anything you need from the lungs. So here's a picture of the pleural cavity around the lungs being evacuated with a chest tube. So this is an emergency procedure performed whenever the doctor looks at the x-ray and sees that you have that typical very black area on one side and some more white area over there with the air pushing it to the left. And so it's really a pretty simple physics problem. You just have very negative pressure here in this jar, and that's used to evacuate the pneumothorax.